that retirement.
Okay.
Leave that. Hey, I tell them up here every day Saturday.
No, that's right.
Oh, yeah. Hey. Kevin got into it. I said that we take positive things and make the next one. They love how it's talking about what rights all. Oh, yeah, y'all think of Facebook that way? No, yeah, so probably could have paid for a portion of a payment or whatever. Just heard that Catherine, that's the way it is around here. People do positive things, it all comes out negative. I mean, what's that?
We got budget for public works, we got budget for commons, we got budget for.
Yeah. I guess we already built it. There you go.
Call the meeting to order tonight. Thank everybody for being here. We'll start off with a moment of silence, then we'll have the pledge of allegiance. Join me in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Need to have approval of the agenda for tonight.
I will make a motion that we approve the agenda as presented. We didn't have anything to add, did we, Becky? Okay, I'll make a motion we approve the agenda as presented.
All in favor? That brings us to public hearing. Tonight we'll have a public hearing pursuant to section 15.2-2204 of the Code of Virginia 1950 as amended to consider Covington City Code by amending and reenacting the recommendations of the Planning Commission for the purpose of rezoning request of Allegheny Highlands Community Service Board from R3 to C2. The lots are described as 14-146-6 and 14-146-7, located directly beside 313 on North Monroe. We had a sign-up sheet out there, and we've got people signed up for two different things. If you signed up for the public hearing, you will speak first. We'll finish the public hearing, then people that signed up under citizens' comments will speak after that. So if you're here to speak on the public comment on the public hearing section, you'll be in the first line. If you want to speak on something else, you'll be in the second line. I've asked Eric to come and give us some information about what we're getting ready to look at. How's that?
Yes, sir. Good evening, Mayor, other council members, Mr. Dressler. This evening I'm here to offer some background information related to the property. It is directly behind 313, it's more an accurate description. His address is 320 East Pine Street, and there's directly adjacent property that is vacant that is attached to it on the east side of that property, so toward Allegheny Avenue. As you mentioned before, it's lots 6 and 7, block 146, sections 14. Our future land use map has that area identified as a transitional mixed-use area. So a mixture of commercial and residential uses leading forward in the next 25 years is what our comp plan identifies. Planning Commission did recommend approval on their meeting at 8/13 with 3 conditions following dwelling with, which are included in the ordinance, and I'm going to read those to you. Condition number 1, use of the property shall be restricted to only those uses listed in the rezoning application and associated submitted documents. 2, if the use of the property ceases for a period of more than 2 years, the property zoning shall revert to a C1 zoning. And that was intended to give more protection to unintended uses available in C2 later on down the road. And 3, the property will be combined into one lot. So through the process and their construction that they're proposing, which is all interior construction, no exterior changes, maybe cosmetic, but those are just normal things that are done day to day without permit issuance. The whole property would become one property, and the zoning with the conditions would apply to the entire parcel at that point. And so the intention was, through discussions with them, I had concerns about across the board C2 zoning. There's some uses allowed in C2 that are less compatible for residential districts, though their operations will be much the way they're going to do it today, which I'll let Ms. Barber speak to after I'm done. But I didn't want to have the day that we had a restaurant or a nightclub operating that deep into a residential district, and I voiced those concerns, and the CSB was amenable to having condition-wise zoning applied to help protect the interests of the residences in the future. So that's where the conditions came about in this process, and I'm happy to speak to any questions you have related to the land use or the comp plan as it relates to this.
If we have questions, we can come back.
Absolutely.
I've got one right off the top.
Okay.
Can you tell me which part of C2, what they plan to do falls under?
Yes, it's more like medical clinic type things. And so clinics, you generally have some sort of services or dispensing of products while they're treating people. They currently do this at their site, is my understanding. And so they're just trying to utilize the existing building space that they've owned for a period of 17 years that's been zoned residential and combine it into their existing operation, basically. And so they're going to create a lot more office spaces, a few more meeting spaces. And like I said, I'll let Ms. Barber speak to the actual operational side because I'm more the land side and guiding the process. But that's kind of the intention that their documents show. I do have a complete submittal set here if any of you all need to review that. It has a ton of construction related documents. You could look at that and see the floor plans and elevations of the exterior building reflect exactly what's there today, no changes.
I do have a question, and you may have already addressed this. There's a little confusion on my part, and I think in the community. Somehow, they're not doing, y'all not doing overnight.
No, it's not in it anywhere.
Okay. Somehow that confusion was put out there, and I wanted to make sure that that wasn't, if that was a thing or wasn't a thing.
Yeah, that's not a use that's listed in their applications for this location. That's not there.
And it's not a use that's listed in C2?
No, it's not.
Okay.
Okay. With that, if you have more questions, I'm happy to answer those at any point, but I'll turn it over to Ms. Barber to speak about the operational side.
You just hang around.
Yeah.
Well, I can stand right behind her.
You got your seat here.
Mayor Savold, Mr. Dressler, and other members of the council. I just wanted to tell you a little bit about what we're planning to do at the CSB. We applied for a $1,069,000 cooperative grant through the Opioid Abatement Authority, and this grant was made possible by the city of Covington and Allegheny County to allow us to apply for these funds. What we're going to plan to do with these funds is to take our old Burke building, which we've owned for 17 years, and do an expansion of our current services that we're offering right now on Monroe. The CSB has grown. We're upwards of 160 employees, and many of the staff are now 2 to 3 in one office. so there is no space. And then also when it comes to privacy and doing the business that we do, we'd like to do an expansion to add 17 to 25 office spaces, and in addition have some flexible offices. We're gonna have a training room, and in addition to that, we're also gonna have psychiatry and those kinds of services. So basically, substance use services are growing in Allegheny County. The latest VCU study that we received, which was a well-being study based on insurance data in Allegheny County, 4,550 individuals in Allegheny County all have a mental health disorder. And normally when you have a mental health disorder, then substance use is easily followed. So we just like to try to wrap our hands around this by allowing more space so we can serve more of the community. And you know, that's really the gist of this project. There is no overnight stays. We have been talking about doing something like that in the community, but not with this property. We're just a matter of trying to consolidate the buildings. We're gonna have an elevator put in, and there will be a first floor and a second floor. The Burke building has been vacant since my predecessor and the board bought that before. And I've been there 16 years, so we want to do something with it. And this is an opportunity to get these funds to do it. If this project is not approved, this $1,069,000 will go back to the Opioid Abatement Authority, and we will not have access to it. The Opioid Abatement Authority, because they have approved us for this year, we would have an opportunity to apply for another $1 million grant to finish the project next year. So the total cost of this project is projected to be $2.4 million. Now, entertain any questions you may have.
I'm so lost. I'm not sure which building you were talking about. I know the building y'all are in.
Okay, the building that we're currently in is at 311 Monroe, and that was 3 or 4 businesses.
Yeah.
Many years ago, the CSB bought those businesses, and that's been consolidated into one clinic. And right behind the building
That's what I'm talking about.
was the Burke building, and it's adjacent to our building, right beside our building. There's a wall that we share. So the
Y'all not gonna do anything with the parking lot behind it?
Well, I was under the impression that behind the building that we owned, that was an alley, until we found out that we owned that property. So it is not an alley. So, so that is not, that lot behind the building belongs to the CSB. It is not an alleyway. People have been using it as an alleyway, but it is our lot.
Do we have questions?
Yes.
Okay.
I wanna make sure everybody's, you good? Any of y'all got any questions for her?
Not right now.
Okay.
Might after we hear some comments.
All right, sure.
I just provided Mr. Hunter with a copy of the map that shows the actual 2 lots that we're considering tonight. You'll find those in your packets. I added them in prior to the meeting, but it's just an aerial photograph. The shading represents the 2 different zoning levels in the area. And so the C2 is the existing CSB property. The area drawn out in the blue line is the 2 lots that you're considering tonight. Change.
The alley/parking lot is one of the lots that's gonna be rezoned.
Correct, that's not a public alley, according to my research, that is a private drive, so it's on a privately owned lot, which the CSB is in control of, as well as the Burke's building, bowling alley, I've heard it called all of those things. And so yes, that's kind of an overflow parking area. And due to the nature of the parking in the neighborhood, we just were looking for additional parking spaces. Planning Commission did speak a little bit briefly about the parking that was available for the CSP on the site. They're not planning to add additional staff. They're just trying to make more space for existing staff and provide more services. But they currently have, I can't remember the exact number of spots. 37, and that was on the lot in front of the building.
Right.
And they have remote parking lots that employees park on in agreements with First Christian Church to use their lot during the church's off hours. So it was kind of deemed that that was adequate parking, especially with the addition of a little bit more overflow on the back. If they utilize that for parking, there's a screening requirement for the adjacent residential district, which would have to either be a fence or a vegetative screen.
And that would be the lot with what we thought was the alley?
Yes.
Okay, between that lot and the adjacent house?
And the adjacent house, yes.
So we'll start the public hearing. I'm gonna go down the list. I've marked a couple people I know that aren't here to speak to the zoning unless they want to, but Corey, your name is first and you want to speak to something else. Is that
Yes.
right? Bob McAllister, would you care to speak? Can you
Yes, sir.
Come to the mic and give your name and address.
A little dizzy, I have to hold on here. Bob McAllister, I'm the city's, one of the city's representative on CSB, and my address is 226 East Fudge Street. And I'd like to voice my opinion that I think this is a great thing for us and for our potential patients that's going to be coming there, and also for our staff, which is really crowded. And it's probably a dangerous situation to have that many people in one capacity there, that in case you have a big fire or anything, it'd be hard to get folks out of there. So the space that we need is very much needed, and I would appreciate your vote in favor. Thank you.
Debbie Staten, are you here to speak on the CSB public hearing?
Good evening, my name is Debbie Staten. I live at 311 East Fudge Street. This building that they're talking about is basically my backyard. One thing I'm very concerned about is that early in the mornings, as people are waiting for them to open, you know, there's a lot going on in the parking lot, and the neighbors right there along that area, we hear them. So it's like, are they gonna do more than what they're doing there now? You know, it just makes me wonder, what do we have to put up with as far as our property being adjoined to it? The back alley for one. 'Cause I've been hearing different things being said that was going on, so that's why I come to see. You know, what is it that they plan on doing long term?
I'm gonna have to guess at this next thing, you right back out here.
I'm sorry. Mr.
Oh, Luann, I'm
I'm sorry, Ms. Ogden, I get right here.
okay, good.
Good evening, I appreciate your time to speak with y'all. Luann Osborne, 307 East Fudge, and CSB is directly behind me. I have some concerns about the increased traffic on the alley coming out of that parking lot. there's a lot of traffic already, and they fly down that alley. So to put another 15 spaces there, that cars egress out onto the alley seems a little excessive. I also have some safety concerns. I walked around the building. There are 8 exterior doors. None of them have a camera. None of them have a light. So to me, that would be a danger for people to do some maintenance, if you will. And the only camera is out at the dumpster, and there's a light there because people were using the dumpster for not garbage. And so I don't know whether that light, I don't know if it's a timed light or what. But and then people, as Debbie was saying, congregate around. There's a smoking area on the front right corner of the building, and people congregate that there to smoke and wait for the next their next meeting. I know that they have a lot of foot traffic. I'm concerned about additional foot traffic with the expansion of their property. And so kind of wondering, you know, is their patient load gonna increase? If they're gonna be increasing any services? And so those are basically my concerns. With the safety especially. Thank you.
Thank you. Sherry Martin.
Good afternoon. My name is Sherry Martin. I'm a co-owner of several residences and land on the 300 and 500 East Pine Streets in Covington, Virginia, as well as President 311. I've come today to voice my opposition to the application request of the Allegheny Homes Community Services Board to rezone 320 East Pine Street building and adjoining lot to C2 zoning. Based upon the copy of the application packet I was provided, I have concerns about some of the information listed with reference to hours of operation, parking, access, security, and further disruptions to the residential community that will be impacted by construction noise, increased traffic into the residential community via automobiles and pedestrians, known and unknown, regarding East Pine Street, East Fudge, and Oak Street, as all are only separated by alleyways. The application states the number of individuals receiving services will likely increase, but the renovation will not add additional employees at this time. What is the exact number of individuals being increased to that will receive services? At this time is not a measurable and specific time frame. Thousands were quoted by the VCU study director Barbara stated as a statistic as being in need or eligible for services. Thousands more. During the planning commission meeting that I attended, I received a notification of by certified letter would begin at 4:30 p.m. I arrived early to find the planning commission meeting was changed without notice to 4 p.m. While CSB Director Barbara was making final comments, she did answer questions from the planning commission. She was questioned by one of the members of the planning commission about possible barriers to service, and staffing was her answer. I'm curious as to how you can increase the number of individuals that you are going to be servicing, yet there will be no additional staff, and still be effective and have a meaningful impact. Director Barber stated that her organization could not turn anyone away at the meeting of the Planning Commission. Who will benefit and receive services if that is the case with this rezoning and, more importantly, expansion? This is not just about office space. You need additional office space because you're going to be servicing individuals. It's not just renovation. It has a counterpart. Is the message that we want sent out that our community is a sanctuary city and a free-for-all that promotes the ideology that all we have to do is make it to Covington. Who is going to benefit from this grant funding? You guys, earlier, you addressed the concern I wrote in my statement about it being a 24/7 overnight access facility, so my next comment would be irrelevant. The application packet states that the rezoning, renovation, and expansion is for community use by certain support groups after normal business hours. Where are these groups meeting now? And why do they need to use the CSB in the future? Will there be security provided after normal business hours? In the beginning is not a quantifiable time frame. It sounds as though the application language is generic and in general with plans in mind, just not on paper for accountability purposes. Words like anticipate is also not quantifiable as is referenced in the anticipated growth section of the application with regards to growth being based on the need for services. As far as noise, odors, and lights, I have never heard of a quiet paving project. Yet the application states there is no additional impact expected. East Pine, East Fudge, and Oak residents don't need the CSB intermixed in our neighborhood and overtaking it. My question is, with over $2 million in grant funding, why can't CSB relocate to downtown Covington on Main Street or Maple Avenue, where we have several empty buildings that are already zoned commercial for business with existing parking and the security infrastructure of the police, jail, and court system? Also, what about the old Kroger building with plenty of parking and 2 pharmacies as neighbors? A mix of residential and retail accessible to anyone using the services. My belief is that the services rendered do not belong in a residential community with limited access on a one-way street, and that's exactly what East Pine Street is. From 200, 300, and 500 block. 200 and 300, one way, 500 is two way, but it does not seem to me that any security concerns have ever been considered by the organization, and I certainly didn't see any addressed with this planned expansion in the application. It's my humble request that you all reject this. Thanks for allowing me to speak.
Pauline Lewis.
That's Paulette.
Oh, excuse me. It sure is. I have glasses.
You know, since my mother named me Paulette. I'm Paulette Cosby Lewis. I'm a lifetime resident of Pine Street. I grew up at 313 East Pine Street. I'm currently residing at 332 East Pine Street. It has always been a residential area. We've always been about family and community. We have several people on the street that has children, that has grandchildren, and many elderly residents. My concern is about the safety, and I don't see where it's been addressed. The residents of Pine Street does not want this. We were not notified. One resident that I spoke to, Sherry Martin, received a letter. No one else that I spoke to on Pine Street knew anything about it. If it was not for the fact of her letting us know and Mrs. State letting us know, we wouldn't have known anything about this. This is not something that residents of Pine Street would like.
Or Fudge.
Or Fudge, or Oak.
Robin Sweeney.
Good evening, Mr. Mayor, Mr. Dressler. My name is Robin Sweeney. I live at 909 East Dolly Ann Drive here in Covington. I currently serve as Vice Chairman to the Allegheny Highlands Community Services Board. I am here obviously in support of this rezoning request. I hear the concerns of the residents here. I firmly believe that the CSB has been a good neighbor and operates in good faith to that extent. One of the questions that was addressed about if we're servicing more, then there will be more staffing. A lot of the services that I offer are done by telemed, which are done through a Zoom call. I really wish I didn't have to be here today, this evening, to ask for you all to consider this rezoning, because if I wasn't here, then we wouldn't need this space. Unfortunately, in this day and time in our community, we all know people. We have brothers, we have sisters, we have children who have a need for this. And I feel confident when Ingrid comes back up to answer any concerns, she'll be able to address those. But while the focus on the building will be substance abuse, a lot of those staff members will work with other aspects of our services that we render. We are now working with adolescent, preschool age children with mental health issues. We want to be a good neighbor. We strive to be a good neighbor. We care about this community. I am a lifelong resident of Covington. I went to school at Rivermont. I graduated from Covington High School. I have always, when I left, I've always come back home. This is very personal to me as well. Having been a parent with a child who had mental health and social issues at a time where all you could really do is put them in a car and drive somewhere until you could find someone who could help them. We can't let that happen in this city. We have to let our citizens know that we care not only for their physical well-being, but for their mental well-being. So on that note, I certainly hope that you will consider what this rezoning will do in helping our community. And I thank you for your time.
Thank you, Robin.
That's all the people we had signed up to speak in the public hearing. Did anybody miss signing up? We don't want to quit before anybody wants to speak. I think I'd like to ask Ingrid to come back and ask some questions. Do any of you have questions, council? None of you? All right. I got all kinds of stuff. So you will put a parking lot in the back?
Yes, sir.
You'll pave that?
Yes, sir.
How many spaces will they give you?
I think when they were looking at it, we were thinking somewhere around 15 to 20 spaces. And I do want to speak to the security issue. We've had cameras installed at just about all of our locations. So on the perimeter, and Adam can correct me if I'm wrong, I think we have about 8 cameras surrounding the whole entire building. And the perimeter design is also built in to have camera access around the new part of the building. And we also have cameras on the interior of our building on all our corridors and in the common spaces. We cannot have cameras in the therapy rooms and in the rooms where services are provided. But we just did a huge expansion for that. So the cameras cover all of the parking lots, the sides of the buildings, the alleys, the back, and we'll also cover the back areas as well. So if anything happens, those cameras are steadily recording all the time. And I'll also speak to the fact that, you know, our local police department, the Covington City Police Department, has worked closely with us. And if there's any type of commotion or anything that's going on, we can put a call into them, and they're usually there within a minute or so at our doorstep.
So are those cameras monitored 24 hours, or do you just have to record it?
They're recorded and 24 hours, 7 days a week. And if we ever need to go back to look at anything or zoom anything in, I think it keeps about a month's worth of recording at a time.
There was a question about fire safety. How many fire exits do you have?
Well, I want to speak to the fire safety with the doors, because if you have a number of employees in there, you don't want everybody going out the same entrance.
No.
So there are about 7 or 8 areas that they can vacate the building, and we do have our fire escape routes posted for licensure requirements in our building and in our facility. So that will be in the new section as well.
A little bit of that.
building official also. So during their construction phase, when they do a plan submittal, I will do a review for compliance based on the spaces, the distances to exits, the occupant loads that are allowable in all the areas. That's all part of the plan review process before the building permit is granted. So they will be required to have a certain amount of exits, egress pathway sizes, and all that's evaluated. And I go through the document, take measurements out of the document, make sure that it's adequate for the amount of space. And that process determines the occupancy level for areas of the building.
So clients entering that portion of the building, do they have to come through the front of the building, or would there be a rear exit for them to come into the back of the building?
Right now, the plan that they could come through the front, and then we're gonna have a hall corridor that they can walk down to get to the back side of the building. There will be an outside of the building where you can leave on the Pine Street side, but that's just, as he said, for fire safety, and also if someone was coming in just for substance use services, they can come through that door. I will also, yes, sir, and I will also speak that a large number of people that we serve walk to services because transportation is a barrier here in this community. Not everyone that comes to our front door has a car. So the radar bus will let people off for their appointments, and the radar bus sometimes will pick them up. And why we really take pride in being in the community and in the city is because people can walk. They can walk to TAP, they can walk to the CSB, they can walk to Safe Homes, they can walk to downtown. And as I said, many of our residents don't have transportation.
On the paper that you gave us, Project 1 seems to be what we're talking about today.
Yes, sir.
Is Project 2, is that a part of that building?
It is not a part of that building. That is a part of a different location.
But you said that the CIT would be in this building.
So CIT will not be in the clinic and it not be a part of this expansion. We're looking at another property to do some crisis stabilization beds and also to put our CIT assessment site and have 23-hour services for people here in the community.
That's a different site.
That's a whole different
Project 2 is not anything to do with what we're
Doesn't
talking
have anything to do with this property.
But you're gonna leave CIT at the hospital until the second project.
Until the second phase, yes, sir. That's a totally different project. We're looking at a $4 million project there.
Josh, I think it's all things over there.
I've got a question.
Go ahead.
What are gonna be the hours at this facility?
Well, currently, right now, our hours are, staff come in at 8:30, we open at 9, we close at 5 o'clock. I will tell you there has been some solicitation from the community about having services on, in the evenings and on weekends for those individuals who work and they can't get access to services. So the space will allow us to do that. We haven't made any plans right now to do that. So, for example, running an IOP group or maybe having therapy services up until 6 or 7 o'clock in the evening. There's a possibility that we can do that in the future with the space. One of the reasons why I haven't done that is because we haven't had the space to do it. But right now our hours are 9 to 5.
And no crisis stuff will be done here, like a
I'm not gonna say no crisis because we do emergency services out of that facility. So right now, if an officer brings someone in on an ECO, and it's during the day, they can bring them into the clinic setting. But that is the reason why I'd like to do a second phase project somewhere here in Covington, where we can have a crisis center.
I was looking at the second phase, I reckon.
Yes.
Where you've got recliners and all that.
Yes,
But that's not gonna be
that
at
has
this
nothing
building.
to do with this. That has nothing to do with this project.
That was provided to you all because there were so many questions about the other project.
There's no overnight stays in this building for this project that we're talking about tonight. And I will go ahead and quote myself again to say, no overnight stays in this.
And your committal will be done at the hospital until phase 2 is built?
Yes, sir.
Okay.
Yes, sir.
So at this project, we're not talking about overnight stays. We're talking about maybe some outpatient program later in the evening?
Possibly, there might be some outpatient programs later in the evening, or maybe on a Saturday, if the possibility and the feasibility of the staff is there. Because we have people that work from 9 to 5 and they're trying to hold a job if they have a substance use disorder or a mental health disorder. And a lot of times they're not able to come in for treatment if they're working. So there's been a request, you know, from the community, but I haven't opened up that door as of yet.
So what's the length of a normal IOP day?
So intensive outpatient is very, very different from just individual therapy. An individual therapy session could last for 30 minutes, 45 minutes, an hour and a half, depending on the intensity levels. Intensive outpatient services is services where people come in that have an addiction problem, and they come in 3 times a day for 3 hours a day. So it's 9 hours of intensive therapy that they receive. And of course, it's done in groups, and they allow them an opportunity during that 3-hour time frame to have a break and to use the bathroom and use the restroom. But that's intensive outpatient therapy. And that runs for a matter of 12 to 16 weeks. So that's kind of how outpatient therapy works.
Did you say 3-hour sessions a day?
Yes, it's
A
three
week.
days a week.
Oh, okay, I thought you said a day.
No, she did.
That's what I got.
It's 3 hours, it's 3 hours a day, 3 days a week.
So if you had a nighttime program, evening program.
It'd be 3 hours in
It'd
the
be
evening.
3 hours, so if they came in at 5, they'd be gone.
5 to 8, yes, sir.
So probably the latest that would go on would be 9?
I would say 5 to 8, 8:30.
Yeah.
Yes.
So then those people, would they be leaving at the front or would they be leaving at the back?
They will be leaving at the front of the building to make sure everybody.
Yeah, that's going to make a difference, because
Yes.
there's a lot of concern about people coming
Yes.
up toward the alley.
Yes.
And it's 8 o'clock at night, it's dark.
Yes.
I understand their concern.
Yes.
So I just wanted to make sure I've got everything straight in my head.
For those evenings, especially when the time changes and you've got the parking out back, you gonna have lighting?
Yes, sir. We're gonna add.
How is that gonna impact, especially the adjacent property owner?
Well, we'll have security, we'll have lighting around the entire facility, and that's for security purposes, and we currently have lighting right now. If you were to ride by after hours, the parking lot is lit because janitors are in there working after hours, and we wanna make sure when they're leaving the building that they're safe. But again, we have cameras, and these are very sophisticated cameras that we have installed around the perimeter of the building that will pick up just about anything that's going on around the whole perimeter of the building.
Well, what worries me, especially the property, and I don't know the address, it's on Pine, it's the one right behind the alley lot. is
Yes,
what
sir.
I'll call it. Floodlights, going into their bedroom windows, that type of thing. Is that house empty?
It's empty.
That house is not empty.
Our ordinances actually prohibit the spilling of light directly toward the residential district off of commercial property. So in this case, in the review process, we'll cover that down lighting is all that's allowed. That way it's not directed at someone's property.
I don't know yet. Anybody else got
You got
anything?
anything, Fred? Randy, you got any more questions?
The CSB has been around for 40 years.
Yes.
We just celebrated our 40th anniversary. So, I'm hoping that even when I'm gone, that this service is still gonna be here for the community. So we don't wanna be stagnant, we wanna continue to, exist, and we wanna continue to provide services to this community.
I'm not gonna lie, when I came in here, I was good to go. Stephanie,
I'm sorry,
they're
what?
talking in class.
No, okay. So
Anyway, no, I'm talking, hold on.
No, it's with your question, Mr. Vice Mayor, I'm sorry.
Okay.
She was saying that was the CSB in that specific building for 40 years.
Okay. It's been close. I especially with the $2 million, that got my attention on the positive end coming in. But I'm not gonna lie to you, the concerns raised tonight have caused me concern. And so we don't normally do this. Can you grant me a little bit of leeway here? A little bit?
I'm going home at 9 o'clock.
Okay. Let's take Sherry, for example. Did she address your questions? Was there anything else that didn't make sense that because I really would love to get to a point where we can address the concerns and then get to where we need to be with you all. Because what you're showing here for your end of is wonderful and desperately needed. But once again, if I vote for it with these concerns, even though this isn't my district, I'm doing them a disservice. So is there any way we can get to, with some of these questions that were brought up, can we get to a commonality, common ground between the two? And that's kind of where I was hoping to be. So I'll use you for an example, Sherry. Was there anything else that she hasn't addressed that you need addressed to make this good for you?
I'm not as college-y.
And I don't hear as well, so.
So, I've heard everything that's been presented. I heard the emotional plea. I know, like any other place in America, we need the services. But I live on Pine Street. I live on East Pine Street. And so, anybody can put in an application, everybody can have great ideas. But I'm on East Pine Street. And so when I hear generic times, because we're just thinking about, there's nothing that said, oh, well, this is the expanded hours, well, possibly this. Possibilities are not specifics. And so, again, no one's addressed, I haven't heard anything about the number, like I asked, what is the number of people that is going to increase that's being brought into the community to provide them services? And I'm sure we have something in Covington that we can get for $2 million that already is zone commercial, where everybody fits into one space. They can put up every support group they wanna help in there, and we all can be happy and married. It's just not at East Pine Street.
So the opioid abatement dollars do not allow for any new build. It allows for renovation. So that's what we're doing, is simply renovating the property that we currently own.
Eric?
Mr. Mayor, I'd like to offer just one more thought. I just want to remind council and everyone attending that what we're talking about rezoning is only the Burks building and the adjacent vacant lot. The current building that they occupy is probably only utilized 50% right now. The rest of it is actually storage area that would be included in this renovation, and that's a by right use that I cannot deny. It's zoned proper for it, and it has none of the conditions or restrictions that they've offered as part of this process. And so they can do, and it would leave the community around it less protected the day that their use ceases, because it's an unconditionalized C2 zoning applied to that building currently. And so I just want to add that as information for you to consider, along with everything. The only building that will be increased in use level in the adjacent lot are the two lots that are identified on the map. The other property they already occupy is an unconditionalized C2 zoning level.
So this C2 conditional zoning just covers those two lots though?
It'll cover those two lots, but as part of the process, they're going to have to be combined into a lot, and we can't allow a building to exist over multiple lot lines. This is something we've been cleaning up through the years. And so this will become one contiguous property with the level zoning applied to the entire property at the end of the process.
Can we allow to say something, my question?
Yes, sir.
One of my concerns was that you have a whole lot of people start coming to this place. They're being dropped off, some of them getting dropped off, some of them being walking. Now on First Street, for instance, I know there's a lot of kids riding bikes out there, the young kids. 6, 5, years like they're playing. When these people come out this building and nobody there to pick them up and they decide to wander around in their community. Now, I don't know if that'd be right for strange people to be running around in their community. You got kids out there playing on another street. I mean, they take a couple steps, say, well, I'm gonna walk up Pudge Street. I'm gonna go up, and you got your kids out there on bicycles out there playing, completely strangers. I don't think that'd be good for nobody's community. You shouldn't have that.
Many of the people that we're serving at our clinic are citizens of Covington and Allegheny County.
But you're going to have more people, you say, coming from everywhere. I mean, they always people not gonna be living in Covington.
They're not coming from everywhere.
These people just for Covington only?
Yeah. Serve they're serving our catchment.
Alright, now that's my next question, cause everybody
It's our
said,
catchment area.
hold up, folks, hold up,
It's still in.
folks.
It's still in Covington.
That was gonna be my next question. Everybody's talked about coming in. Can you clarify that?
So right now, we currently have what they call same-day access. It's open from 11 to 3:30. And we see people and do assessments without overwhelming. Many of those individuals that we see are citizens of Covington. On occasion, there may be someone coming through. We're not gonna deny them access to services if they come through. We don't turn anybody away for services, because we never know when someone is in need. But, we provide you a list annually of the number of people we serve for the city of Covington, Allegheny County, across all of the services that we provide. And we billed over 35 plus amount of services last year. And we served over 1,400 people in this area. There were about 100 people that we served through emergency services, but they may not have necessarily been in our building. It may have been that law enforcement took someone to the ER and we served them. And then we went down there to provide the services. Because the clinic is only open 9 to 5.
Right.
That's why I would like to expand hours in another facility. And that's the second phase project that we're talking about. So that we can serve people at 8 or 9 o'clock at night when they're in need of services. Because the clinic is closed at that time.
Okay, now I'm really confused, which doesn't say much, but, so you say this is just for Covington and anybody who.
Allegheny County.
Okay, because I kept hearing, that's why I wanted y'all to be quiet for a minute so I could hear her. So you're saying it could be county or city?
Yes.
Okay,
That's our catchment area.
okay.
There are 40 CSBs across the state of Virginia. We serve Allegheny County. There's another that serves Rockbridge. There's some in West Virginia. There's one that serves Stanton. There's one that serves Roanoke. So we serve Allegheny County.
Okay.
And does Rockbridge?
Rockbridge serves Bath.
All right, now we've got, Greg wants to say something.
Yes.
Somebody over here had their hand up with Greg. I'm gonna get back into routine. I'm gonna have to ask you to come to the mic. And go
I
through
just
the
wanted to
routine.
answer a question.
Yeah, you need to come up here and go through the routine.
That was my fault, I apologize.
We have a lot.
My name is Greg Rice. I live at 352 East Oak Street. She said that we are providing services for Allegheny County. Those people that were brought in down at the hotel, do they use this service? They were brought in here. They were child molesters, and if you look on the register, there's 178 child molesters here in Covington. 192 in Allegheny County. Are these some of the people that were serviced?
I don't know. I mean, we wouldn't,
They live at the
when a
hotel.
person walks in, we don't know, we don't run to see whether they're a child molester or
Well,
not.
I mean, that's
We're
that's
just-
something we should be,
Right.
we should find out what's going on with
Well,
these
that's a
people
violation
before you
of our
put them-
rights if we decide to run everybody through a registry to see if they're a child molester or not. That's
Okay,
not,
so then that gave them the right, so that them keep them people coming in, your child be molested. You just violated that child for life. So we do need to check in to see what's going on with these people before we.
What Greg's talking about is the prison
Yeah.
system brings people to, used to be the Knights Court down there.
Yeah,
below Burger King.
That's right.
And, when they let people out of prison, they bring them there. And they live there.
Right.
Now, I don't know Stephanie sat behind you at TAP, and I think y'all probably serviced some of those, Stephanie, with those violating their confidentiality.
Mr. Mayor, Mr. Vice Mayor, Mr. Dressler, I tried to stay out. But, so I don't want people to get confused with the Community Services Board. I'm a case manager for Total Action for Progress. I do re-entry and pre-release. So people who get out of jail come to TAP and they need a place to stay. We put them in a hotel because we don't have a place for them to go. Now, probation used to use no, it's a new name now. I use it all the time. But no, they don't stay at the Magnuson, they stay at the 19. But now, M-Star, thank you, that's it, David. But now, they're not staying there. I don't know what happened with the state, and I don't know what happened with probation, but now they're mostly going to Stanton, Virginia. They're putting them there. The things that you were saying about people coming here staying, they get out of jail, right? So the first question I say is, where are you from? They tell me, I say, well, you need to go back there with your parents, with your mama, with your family, with your community. And people say, no, I like Covington. I can make it here. I can pay the rent. I can buy my food. These people are nice here. I can stay here. So that's where that group of people, they don't come from the case management of the Community Services Board. They may be one of their clients, but most of the people who are dealing with situations, and everybody in here has a family member that's been to jail. I know I have, and I know that they needed help. They were in crisis with mental health. And so I think one of the things that we could do to help all of this is that if Ingrid and one of her staff members could give a tour to the people on the street so they could see, I didn't know that all that room was back there. So they can see what is gonna be back there. And I hate to say this, but I don't know, maybe this is a time for y'all to table this and think about it until the discussion can be more between the CSB and the City Council. I'm the chair of the CSB. I support it because I see mental health. I counsel people. They come to my house and you know what they say? Please don't tell anybody I came to you for counseling because I'm going through. And the CSB does that professionally. I can't prescribe medication. I can't send them to a place, but I can tell them to go to God. And that's what I do. And I think today the community needs to understand how important it is for us to have these services. You call me up here, and I do what I'm supposed to do.
Thank you,
My question is, my follow-up question is, we've talked about the drug abuse, which everyone knows is a problem all over, not just in Covington. What other services do you offer besides drug counseling?
I'll speak to that.
That's a good question.
I know it is.
So as I was just stating, we have what they call same-day access intake, where people can come in without an appointment and they don't have to wait 6 weeks, 12 weeks, whatever, and they can do walk-in access, and an assessment is done. In addition, we provide psychiatry, medicated assisted treatment, case management. We also provide early intervention services. We provide prevention services. We provide just about everything out there that you can possibly think of. I'm the little small machine in the state that could, because many of the larger boards don't provide the services that we provide. So I'm grateful that we're able to do that here in Covington. Because Harrisonburg doesn't provide the services that I provide here. I will tell you that. So there are a number of services we provide. We've also included veteran services, primary care screening and monitoring for people who walk in. They have high blood pressure, we check their high blood pressure, their weight. We check to see if they have any type of problems with their diabetes or anything, and we make sure we link them to primary care services if necessary. So we provide veteran services for those veterans who have PTSD and are having issues. We have Project Link programs for women who are pregnant and parenting, and they have a substance use disorder. They are our priority population because they have another life they're impacting. So we provide a numerous services in the clinic, and I'm proud to say that we are the small engine that could, because many of the other CSBs don't offer those services. When I walked in the door almost 16 years ago, there was a small agency with a handful of services. And like I said, we're building over 35 services through Medicaid now, due to the expansion of what we've done over the years. So we have psychosocial rehab programs for those people who can't work, but they need somewhere to go during the day. That our program is down on Riverside Avenue across from the library. It's never been a problem. It's been there for years. So, again, I work closely with all the local law enforcement agencies. So if there are issues or concerns, they're a phone call away. And you can ask that man in the back.
So anxiety disorder, depression, bipolar, schizophrenia.
You name it. We do it all.
So we're gonna bring all that into a residential.
It's already there. It's already there.
But what you said was that you're gonna bring in more, so you have a small.
I don't know what the numbers are gonna look like here.
So
That's the thing.
and that's the problem.
But it's a growing problem and it's a pandemic.
We need to not talk back and forth. I keep hearing people say we're bringing more people, but I've never heard Ingrid say they're bringing in more people.
It's in the application.
Yeah, she did.
It's in the application.
Yeah, she did say that.
We said there's a possibility, but right now,
Once
this is
again,
more
that's
about,
vague.
this is more about office space, Mayor. That's what it's more about.
Greg, you finished?
No, she was speaking on security cameras.
Come on back up here, please.
She was speaking on the security cameras that they have down there presently. Did y'all catch the people that were sleeping outside down there?
Right. We didn't know that anybody was
Well, if your
sleeping
security
outside.
cameras are supposed to pick up everything, you should have caught that.
Well, we're not monitoring our security cameras 24/7. That would be a paid position to monitor.
Wait a minute, get a little bit out of hand here. We just need to, that's a good question. Could you check on that for me?
Yes, we could.
Thank you.
And also.
Adam, you can go back and look. Do you know what time and date it was when they were out there?
No, I'm not sure.
Where were they sleeping?
Go further, see it. On the south, right up on the walk up on the CFD.
That's not impossible.
It's not.
That's not impossible. Greg, we got, you need to come up here to the microphone and everybody else please be respectful of each other's time and comments.
One of the things that I noticed in the proposal were pharmacy services. And so I would like more information on what current services are offered and what will be expanded. Will they have a full pharmacist on staff? Which brings in a whole other bundle of regulations and oversight and security issues.
So, right now, they have doctors that can prescribe medicines. They don't give them the medicine there, they send it to the pharmacy. So if you're a customer of CVS and
CVS is correct.
if you're a customer of CVS, then that doctor that talks to you will send that prescription to CVS and you'll go to your regular pharmacy and pick it up.
Okay,
So no medication dispensed there.
That was not what I understood, because they used to have a pharmacy.
You still have a pharmacy there?
We don't have the pharmacy anymore.
You don't?
No.
Okay. Because a lot of the CSBs, Valley, in Stanton, Rockbridge, use Genoa, they have pharmacies.
Right.
So that was my concern. Is there
That's
gonna be a
not
pharmacy
uncommon.
on site?
That's not uncommon for CSBs to have pharmacies. We tried it. and our population was low, so therefore they could not bring a pharmacist here. But my concern is, as more and more of these local pharmacies are closing, access to medications is important. And you know that running a free clinic.
Right. So, but you mentioned pharmacy services in your application.
Yeah, the possibility of expanding if we can get pharmacy services here, but we have to find pharmacists that can be on site if we decide to do that.
And the numbers are still down to the 22.
And do you anticipate where that will be?
As a part of the build out, we would probably have to use one of the rooms or one of the spaces that we're having. That's why I said flexible space.
Okay. Thank you.
I can do that where we are now. It doesn't have anything to do with build out.
Well, the pharmacy services does, and if you have a
It
large.
doesn't have anything to do with the build out, because we were trying to get pharmacy services already in the space we currently have and occupy. It's just that our population is small, and it wasn't enough numbers to justify having an on-site pharmacist. It would be no different than going in a Kroger store or anywhere else to get medication.
Okay, but if you anticipate any increase in patient load, will it ever be big enough to?
I don't know. I can't predict the future.
Potentially.
I cannot predict the future.
Potentially.
But you'd have to see those patients in the building you're at, right?
Well,
That's right.
You're going away.
What I'd like to do is let a couple more people speak, and then we'll close the public hearing.
I just wanted to reiterate this one point that seems to keep getting, dismissed. The numbers, the increase does matter. For the point that Director Barber made, a lot of individuals walk to their appointments because our community is set up as a walking community. It's also, if we think about it, and I didn't know this, that they are not aware of the individuals or their backgrounds that come in for service. That's what I understood a few minutes ago when Mr. Rice was asking his question. This is a walking route for children going to school as well and coming home from school. I walked it when I was little and came home from school and went to school. So when we're talking about this increase in numbers, but then we're trying to pretend like we're not talking about an increase in numbers, the numbers do matter. And when I hear, we only service Allegheny County, but then you say I can't turn anybody away. Well, somebody's from Rockbridge or Stanton, and they have a mental issue, a psychiatric barrier. You just said you can't turn them away. They're not from Allegheny County. So I don't want the small things that are trying to be dismissed, which are really the big things. I don't want those overlooked. They do matter. It's not just about renovating a space and blowing out a wall and paving 14 additional parking spaces.
May I ask a question?
Yes, ma'am.
Okay. Ms. Barber, so the state is saying that there may be an increase in the people that need help, right? And in the building that you occupy now, when that number increases, you'll have to see them, whether you have space for that or not. So the same amount of people are gonna come to that building, whether you're using the building you have now, or whether you have a few more open offices.
That's correct.
But what you're hoping to do is give some office space so that when you treat those people, they can be with one counselor in an office without three counselors in an office.
That's right.
So whether we get this or not, the same amount of people are gonna be coming for service.
That's right. And
It's just
I
like
can't predict that number.
Right, because you can't turn anybody away and the number's going to increase because we're.
It's not like we're doing this to increase services. We're doing it because we are so slammed and populated in what the space that we have now. There's 3 and 2 to an office. We're not saying, okay, we're gonna expand this to have more services and provide more services to people outside the area. We're gonna provide those services regardless.
So without these new offices, we'll see the same amount of patients in a smaller building, possibly longer wait times, more people outside. Okay, all right, thank you.
Thank you.
So you said you do have another building coming in, right, correct?
Not yet.
For people to stay?
Not yet.
Right, not yet, but it's coming.
Yes.
And
It
where
is
are these-
coming.
Okay, where are these people? You don't know where they're
I
coming
don't know yet.
from? Okay, so that's gonna increase.
No, that is gonna be people that'll be served here. Because we have people here now that are sitting in the ER and they cannot get services and things that they need. for days, because there's no state hospital beds anywhere.
No, no.
So there would be crisis services for these people if they need them here in this community. This is for our community.
But I called the CSB one day.
Right, but this
Because
is,
somebody
but this
was
isn't
going-
what we're talking about tonight.
No, we're not.
Somebody was going through a crisis one night when I called, and they had a child call,
Mhm.
and they were recording their parent. The parent was seeing things, and I called to CSB to see if I could get them some help. And they asked me, they said, is she still seeing things right now? I said, no, she's asleep. I said, but you need to get somebody, can you get some help for her? In case she wake up and she look at the child and think, because we're looking at something in the corner. And she kept saying, I want to kill her.
So did you call CPS?
I called CSB.
Right, but if
I
it's
called
a imminent emergency, you need to
I
call.
called emergency services.
Yeah,
That's
but
who I
we,
talked to. And she told me, she said, well, since she's asleep, it's okay. Don't worry about it.
we currently don't do house calls right now, but we're getting ready to start mobile crisis services. In a situation like that where someone is in their home and they have an issue or a problem, you need to call the police. And the police can pick those people up and bring them into the ER, or the police will bring them into the clinic. Yes, they will, if you call them.
I've seen.
You need to have a well-being check done with the police department. We don't go to everybody's house around here.
No, we don't, we're not asking you to do that, but if somebody's in a crisis and there's a child
If they're in a
involved, then
crisis-
CFB should have called the police when I was talking to them.
Well, if they're in a crisis and you
They
feel
told me
like
it was
it's,
nothing to do.
no, if you're in a crisis, you need to pick up the phone and call the police.
They will contact us.
We won't settle that tonight, I don't think. I'll let you talk and then we will.
I just got one question. You had mentioned about the, oh, excuse me, I'm sorry, about the telehealth.
Yeah.
So if you have the telehealth, why can't you utilize that service?
We don't have
for-
enough room for telehealth right now, to be
Not when you have
honest.
3 people in one office and you're seeing, and you have 3 clients.
Our providers are still in their office providing telehealth.
What about the space across the street?
That's children's services. Children's services have expanded. We saw 293 kids last year. That's why I put the space across the street.
I have one question, if I can, Mr. Mayor, Vice Mayor.
Would you like to come to the microphone?
No, I think my mouth is wide. You know me well. I think that what you're doing is great. I really do. But, you have a lot of miscommunication in the community that needs to be, you have to let them know exactly what's going on. Cause there's a lot of rumors going around and you're not gonna get anywhere. Council, you're not gonna get anywhere, I'm sorry. They're not gonna get anywhere. You see what I'm saying? And they're gonna feel like council gonna do this, gonna pass it because of that money you're talking about. I'm just being honest. You see what I'm saying? So I really think that you all need to have another meeting and open it up for the public, for the community, and let them know exactly what's going on. Don't be pushing no dirt under the rug. Just let it out. That's all I gotta say, Con.
We'll cut off the public hearing now. We've got this item on the agenda later on and we'll make a decision at that point. Now we've got public hearing, now we've got public comment. Ms. Bowles.
Good evening. My name is Corey Bowles and I live at 511 Northeast Drive. I am honored to have the opportunity to express my interest in being appointed to the Allegheny Covington DSS Board. I'm deeply passionate about serving the families in our community and ensuring that every individual has access to the resources they need to thrive. As a member of this board, I would be committed to supporting initiatives that promote the well-being of families, children, and vulnerable populations in our area. I believe my extensive experience in public education, foster care, crisis prevention, and trauma equip me with a unique perspective to contribute effectively to the board's mission of delivering high-quality human services that help achieve safety, independence, and overall well-being. I look forward to collaborating with all of you to build upon the work that has been done in addressing the challenges that our community face and in working towards innovative, compassionate solutions that make a real impact in the lives of those we serve. Thank you for considering me for this important role. I'm eager to give my time and effort to advance the goals of the Department of Social Services and ensure that our community remains a supportive, caring place for all of its citizens. Thank you.
Thank you. That's on the agenda for later on too. Andrew, where'd you go? That's good.
Good evening, everybody. Mayor.
What's your name?
Andrew Baker.
And what's your position?
I am the fire chief of the Covington Fire Department.
Go ahead.
I come to you today to talk about some of the needs of the fire department and maybe to share some ideas that we can maybe use citywide. And I know that everyone knows that our rolling fleet, fire department included, public works, parks and rec, all city departments, is continually aging. We've tried our best to do what we can to get where we need to be. But I want to challenge y'all to come up with a depreciation schedule for all of the city fleet. This may have been worked on already. I know that I've done some things in the past. I know I did one when we had an interim city manager. At one point, as chief, I've been chief for a little over 6 years now. This is my to be my sixth full fiscal year as far as operating and managing the budget for the fire department. Mind you, on a volunteer basis. The fire department has always done a pretty good job at managing our own, doing what we need to do, and provide the best service to the citizens of Covington. And that is in the city charter for the city to provide fire services to the city of Covington. So with that being said, I just want to paint somewhat of a picture to you. Our fleet in general, we have, and kind of what they're used for, we have 2 frontline structural firefighting engines. They are the engine, we call them engine pumper. They all have identifier names. The engine is a 1992 and the pumper is a 1995. We have a tanker truck which can shuttle water. It also runs car fires or car wrecks in areas that are outlying and we may need more water. That is a 2016 model. The ladder truck is a 2005 model. Obviously, it's an aerial platform truck, 95 feet. If we can get close enough, we can reach it. It provides master streams, lighting, whatever we need. We have a support truck, which is, you've probably seen it around town. Timmy likes to cruise it doing his errands for me and then the fire department. That's the sign truck that has the big air bore one. That's a 1997 Ford that was repurposed. It was an ambulance at the time and it was repurposed for us. We have a 2000 model Ford mini pumper, which is a brush truck. That fights brush fires and car fires within the city. And the reason why we do that within the city is because we have hydrant access within the city, in most areas. And last but not least, as far as our major rolling apparatus, we have utility truck, which was signed a contract that was delivered in 2013. And I'd say most of us probably know the reason why we got that fire truck, and the only reason why we got that fire truck was because it was involved in an accident on the interstate. The reason why we're having this conversation today and we've had this continued conversation for several years, because I put a new fire engine in the budget every year since I've been chief, as far as my budget request. I truly believe is because the city made a gamble before anyone sitting up here was sitting in these seats. The city made a gamble with insurance, and they insured that truck for actual cash value. They decreased it for actual cash value instead of replacement cost. So it was a 98 Freightliner. So you don't get much money for a fire body. It was wrecked, totaled. So we got the replacement cost of a 1998 Freightliner chassis, basically, which in today's world with the fire truck cost, that is pocket change, absolute pocket change. So the money that we had, and the plan that we had was, when the tanker was paid off, we were going to roll right into an engine payment. Well, we had an emergency purchase for that utility truck, and it didn't happen. But that was one of the reasons. But it seems like there's always a reason every year. So I just wanted to paint that picture to you of our aging fleet. We have consistent problems, especially with our frontline structural engines. They're I'll remind everybody, a 1992 and a 1995 model. If you want to do the math, one's 32 years old and one's 29 years old. NFPA, which is the National Fire Protection Association, is basically like the OSHA of the fire service. They're not law. It's not the recommendations that they put forward are not. They're not law, the recommendations, but they are admissible in court if there was a situation or whatever. The recommendations for fire apparatus are 15 years. They're supposed to be either reevaluated for rebuilding or repurposed, and at 25 years, they are to be replaced. So, in the words of the city manager, you know, we kicked the can down the road. It started way before me, way before y'all, because obviously from 1992 till 2000, 2005, really, we got a lot of fire apparatus, a lot of expensive fire apparatus. They were expensive back then. They're way more expensive now. So we have to start somewhere and start being aggressive on our depreciation schedule to get the whole city's fleet back in order. Because we can't keep fighting this fight. Hey, I need this, and okay, well, we got this going on. It should be built in a plan to get where we need to be. To give you a little insight, the first fire apparatus I spec'd out in 2018, I believe it was my first year as chief. It was $630,000, excuse me. That was in, like I said, 2018. They have went up 10 to 12% every year, sometimes 2 to 3 times a year. So the one that we priced out was over $900,000. So $300,000 that has went up in 6 years. Things are really expensive, and we're already behind the 8 ball. So what I'm trying to convey is, it is a serious issue that we have within the city, not only with the fire department, but for rescue, public works, everything across the board. That evidently we had a big boom in the 90s and 2000s. We got a lot of stuff at one time, and we just need to work together, which we have been working together very well. We've had several conversations here in the last couple weeks. I've worked with the county trying to get the best possible deal that we can, because they're also buying 2 fire apparatus. And I'm just trying to do the best that we can, but I need y'all's help, because we're about to be in a bad position, especially with a 30+ fire year apparatuses that are increasingly difficult to find parts. It seems like every time we use them, we have a mechanical failure. Actually, yesterday, the pumper, which is the 29-year-old fire apparatus, we had an exceptional response to the fire on Carpenter Drive. I was there in 3 minutes, and we had a fire truck there in less than 7. And that is almost unheard of for a rural fire department. And like it or not, the city of Covington is still considered a rural fire department. 7 minutes on scene with a firefighting apparatus is amazing. You're hard pressed to probably get that in the city of Roanoke or in any large municipality. We went to put the truck in pump gear, the PTO hit, truck stalled out. So everything that we've done up to that point, guess what? We're sitting ducks. We ended up, there were several people right there. We ended up shutting it down, fixing the problem. We got it back on within about a minute and a half. But this is what we're up against as the fire department, where we need up-to-date equipment that is going to work for us every time, because that is the safety of our guys, and it's also the safety of the citizens of Covington and the surrounding areas that we serve. Anybody have any questions for me? I'm sure you've heard about it, and we beat the bush and beat the dead horse and everything, but I just want to let you know what we're up against, and we're trying the best, working with Alan and BB and Chris to do what we can to get the best product that we possibly can to serve the citizens of Covington and Allegheny County. That's correct, because we do serve a lot of areas, a lot of areas in the county, just because of the geographical location of other county departments. So, thank you.
Thank you for what you do, man.
Appreciate it.
Don't run off after we do the presentation tonight, because the city manager has to report and may help you understand the direction.
I understand. Thank you.
Chief.
Yes, sir.
We have a recognition by the minute. Oh, shoot, we ain't done the minute. How about the minute?
No, you stay right here.
You come on back, it just will take a second to approve the minutes.
Move for approval.
All in favor?
Aye. Hey, come on.
Now,
Well, it's nice that there is a large crowd tonight to see this. A lot of times when I try to do this, not a lot of people are here except for either family members or some of the local folks. I'm going to try to talk to the council and the audience at the same time. Tonight, it was my privilege to have an opportunity to basically recognize members of a wonderful team, and that's basically the Department of Public Safety. The folks understand is several years back, it was a decision was made to establish the chief of police as the director and kind of oversee the operations of fire, EMS, and the rescue squad. With that, I think it's my due diligence, or it's my obligation, that when individuals essentially do a wonderful job, that they need to be recognized, and that's what I'm here to do today. So I'm just going to invite up, unfortunately I got the chief from the fire department, Andrew. I've got my EMS chief. I also have two dispatchers, Regina Woods and Randa. Come on, people. We're trying to get some more folks, but essentially we all have busy lives. So on December 8th, 2023, at approximately 10:25 in the morning, Covington EMS paramedics Adam Gillespie and Jonathan Aldridge, he was actually sitting in the back until they had to call they had to go to, were dispatched for a 71-year-old male who was experiencing chest pains. Before the ambulance even left the station, communications officers, Brandon Isley and Regina Woods, relayed the information or gathered the information and related to EMS exactly where to respond, which is unique because in this particular situation, it was the dry run area, an Overlook Drive 1. If you all don't know, does anybody not know where that is? Overlook is that there's a development that sits, if you're going up East Madison, it's to the left, it's literally the mountain. There's some undeveloped property up there, but there's a couple of houses up there.
It's a Smith Dude property.
Thank you. We actually have one of our towers that actually sit up there. So they were dispatched to the actual event. When they arrived down on location, they actually quickly discovered that the patient, who at the time was hunting, and I think you would appreciate this, Alan, was actually in the woods and was experiencing his traumatic event at that particular time. So they obviously realized, he's a good distance from actually their point of arrival, because we have roads that take us into it, but we don't have anything else that takes us any further back. There's some roads that are undeveloped and stuff like that. And it makes it difficult, especially in this particular situation with limited resources, to get to a patient in that particular situation. So Adam and Jonathan, they basically gathered up the necessary equipment, walked into the woods with another hunter who was actually there, met them on the so-called roll to locate the patient. At the same time, a lot of times we all ask each other for help. Sometimes the fire department needs police department, sometimes the police department needs fire department, or EMS vice versa. In this particular situation, they realized quickly that they're going to need some extra manpower. So they reached out to the communications center to get that manpower. Apparently, it took the paramedics approximately 20 minutes after the initial call to actually get to the patient. Both Adam and Jonathan conducted a complete patient assessment, which included the use of an EKG monitoring, determining that basically the patient was in fact experiencing an acute myocardial infarction, which everybody else, it's a heart attack. All right, thank you. I'm not a doctor. That's why I'm a All right, but they started their immediate treatment literally in the woods and initiated basically cardiac monitoring, IV meds, airway monitoring for management. This is all done to basically at least stabilize the patient at that particular moment and get them prepared, because essentially they had at least a long trek out of the woods. So they basically are stabilizing the patient. Well, I think a lot of people don't realize this. When you see the ambulance come to the house, it sits there out front of the house. The reason it sits there for a little bit is because their job is to stabilize the patient before they're going to transport. It's not just throw and go. Maybe back in the old days. Now they stabilize and they have the training and the tools to do that. So that's what they were doing literally in the woods. Approximately 1100, which is 11 o'clock, members of the Covington Fire Department, Chief Andrew Baker, Assistant Chief Kevin Pettit, firefighters Ross Amatal, Katie Smith, A.G. Bowles, and Jerry Givens, who was actually a retired member of the fire department, all arrived on the scene and basically helped the EMS workers to extract the patient using what they call as a Stokes basket, which I don't know if you've ever seen it. It's kind of like, all right, keep going. So, but it's basically they carried them out onto the logging road, which was a little bit closer. I believe one of the trucks that I think Chief Becker was talking about actually made it further in, so they didn't have to trek so far. From there, the patient was brought out to an awaiting ambulance and transported to an LZ, which is the landing zone 7, which is actually out on Mallow Road. During the extraction and transport of the patient, obviously they continued to monitor and administer the meds per his condition. The patient actually was flown out because of the severity of his condition and was turned over to the Carillion Medical flight helicopter at approximately 11:25. If you all remember, 10:25 is when the call started. Literally an hour later, they had him on a helicopter flying him out. And I'm proud to say that the patient survived his severe heart attack and has since recovered and is most likely either enjoying or just finishing up his dinner with his family. That would have worked about an hour ago. But this is largely due to the quick response, recognition, treatment, and teamwork by all involved. There's not a single part nor a single person's actions of this particular incident or any other incident that could have been more successful without the other parts all working together, and that's the whole part of this. Right? If there was one failure point in this whole entire process, I believe the outcome would have been completely different. And I know, as being a police officer, when we make a mistake, they like to hit us up and show it to everybody the mistake that we made. Well, this is my opportunity, because a lot of times when we get it right, it's not recognized. So essentially, tonight, I'm recognizing paramedic Adam Gillespie, paramedic Jonathan Aldridge, Chief Andrew Baker, Assistant Chief Kevin Pettit, firefighters Ross Emmentaler, Katie Smith, AJ Bowles, Tim Yancey, who's also an EMT, and even the retired firefighter Jerry Givens, and one of my most least recognized folks, my communications officers, who essentially take that initial call, guide us to the call, Regina Woods and Randon Isley, with the life-saving award for the events on that particular day. Appreciate the time. Let's try to get some pictures. Give me 1 sec, let me just get this up. Thanks.
Chief, can we get you to stand with your crew? Sure. Please. Thank you very much. Thank you.
All right. Thank you very much. Appreciate it.
So that brings us to the report of the city manager, and I just wanted to, before he starts, I want to let y'all know that we have a protocol and a way that we do public hearings, and the reason I ended it when we did is I felt like we had about all we can say about what was going on. And we've heard everything that everybody said, and I'm sure we will take it into consideration here in just a minute.
Won't keep you long. Thank you, Mr. Mayor, Vice Mayor, members of council, and citizens. Thank you for being in attendance tonight. Appreciate your interest in local government and look forward to seeing you the first Tuesday of October. Couple quick things. I had mentioned to council about our wayfinding project. We pretty much finalized that yesterday, working with the Chamber of Commerce. So hopefully we'll be going to construction pretty soon. And as soon as construction gets completed, we'll be involved in placing signs throughout the city of Covington to help folks get from point A to point B. I appreciate Mr. Baker being here tonight. No one appreciates our fire and first aid and police services as much as Mr. Dressler. BB and I have worked diligently to improve some things at our firehouse, from alarm systems to air conditioners to kitchens to even an ice machine. So we get the needs for fire trucks as well as all the other things in the community. As the budget was presented to our city council this past spring, BB and I did put some monies aside to begin that process of the purchase of a new fire truck, with the idea of putting more into the 25-26 budget, so we had an immediate down payment, which would lessen the finance. BB and I met with VML VACO Financing just the other day to begin the process of putting together a equipment need list, from camera vans to street sweepers to bucket trucks to all those things that we need in public service to serve the citizens of Covington from a safety standpoint of not just the citizens but our employees as well. Fire truck is included. Okay, so may get you to come in when we begin the discussing of the financing to see if we can borrow money from the police chief's budget but we'll figure it out. So, but anyway, we're not kicking the can down the road on a lot of things. So just want to keep Mr. Baker in that loop of things. If you have any questions, please feel free to contact me versus email. I'm the easiest city manager you ever had the chance to find. We have made some really good headway on some cosmetic improvements at the Jacksonville Sport Complex in preparation for the wall that heals. We encourage you folks, October the 3rd, 4th, 5th, and 6th, to attend the Jacksonville Sport Complex for a very solemn event with the wall that heals. Bring a piece of paper, bring a pencil, and scratch the name of someone perhaps in your family that lost their life, making this country a better place back in Vietnam. So again, we're making some headway with some cosmetic improvements. And along with that, we have discussed the bids with our paving. One of the first things that will be done tomorrow will be paving leading into the entrance of the Jacksonville Sport Complex for the many visitors, of course, that are there anyway, but folks coming in from out of town. So there'll be a new runway, so to speak, from the bottom of the hill to our shelter facility. Again, the sport complex, the wall that heals in October. We're also busy planning a farm fest in our tiny town. That'll be the third week of October. It will be involving tractors. So any of you folks that have a nice old tractor, we have one in Parks and Recreation that's 1950, I believe. So we intend to have that in use that day. But we'll have a tractor drive around the sport complex. We'll have animals, we'll have good food, we'll have great music, and we'll have a good time. So we look forward to a farm fest in our tiny town, and encourage everyone to be there. Cougar football Friday night at Casey Field. Look forward to everyone being there to support the Cougars. We play the folks from down here in Rockridge County. This past Sunday, we had an extremely large ball tournament in Covington. I was privileged to be around a lot of folks that just could not believe that Covington, Virginia had such a park in their hometown. So for all those that take it for granted, a lot of people from the big city wish they had what we have sitting over there off of Edgemont Drive. Busy planning for the upcoming holiday season. Hometown Halloween right around the corner. Our holiday decorations for those that enjoyed the ride around the Jacksonville Sport Complex last winter. Thanks to City Council, thanks to our Department of Finance, we have added to that this year to make that even more enjoyable ride around the Jacksonville Sport Complex during the holiday season. And finally, I want to say thanks to Old Town Covington for their grant, and thanks to Cheyenne Marcus for her absolutely wonderful talents as we are doing our alley gallery in between what we've always referred to as the Brooklyn Buildings, Discovery Center, and the Brooklyn Building now, and the Century Trail. It's absolutely marvelous, and we'll add to some exciting things that we hope to pull off at the Mid-City Mall parking lot with some upgrades and so forth. Any questions from you fellas?
I do.
Okay.
Homecoming weekend.
Homecoming weekend.
Is it this week?
Next week. This weekend is Youth Week at KCP.
So Clifton Ford is having a parade, homecoming parade?
Yes, sir, correct.
When is it?
It will be probably the Thursday. If they do like
me?
we,
I think that's me.
I think she planned it, so let's let her explain.
The homecoming parade will be Wednesday night, starting at 7 o'clock on Ridgeway and Clifton Forge.
Tomorrow night?
No, next Wednesday, before the homecoming game. We will alternate year to year, so next year we'll be back in Covington. I've already talked to Old Town Covington about that. It's gonna, that way we are covering the county. But next week it'll be in Clifton, 7 o'clock, parade going down Ridgeway, turning up Jefferson, I think, to Memorial Park, where there'll be a bonfire. They've hired Ray Keene to do fireworks after the bonfire. There'll be a stage built for speeches by the team captains of the football team and the volleyball team and the cross country team. So.
I just want to get that information out to y'all that next Wednesday, not tomorrow, but next Wednesday is the homecoming parade, and it'll be in Clifton. And who's that raising their hand back there?
No, we'll let you finish.
Vernon. I thought that was you, Vernon.
I just asked Mr. Dressler one question regarding the paving.
I spoke earlier this year regarding East Flood Street. If that one day be part of our street being paved, thank you. I spoke earlier this year about it.
You did.
Yes, thank
You
you.
did. And City Council and Department of Finance gave us some monies, and we just got the bids in, and, I won't promise it between now and the snow flies.
No, I understand.
But I will promise it before June the 30th of 2025. That is the end of our fiscal year.
Thank you.
So it's coming. You will be notified.
Thank you.
With a note in your door.
Mr. Mayor, so the football game is Friday, the dance is October 4th on a Friday. It's a little different than normal, but we had some scheduling problems, so just so you know.
Okay, so we'll move with that. You got any other questions for anybody? Not tomorrow night.
No, Mark, Friday night is youth night.
When we both told Jeff earlier.
Out of that list.
He's talking like it's tomorrow night.
He's still concerned that he has the same kind of flower that we have.
Yeah, no, we got to change it.
All right, thank you, guys.
Thank you, Al.
Yes, sir.
We've got some other business that's not gonna take much time at all. We need to, we have an appointment to the Planning Commission Board to fill. Charles W. Smith Jr.'s term expires. He was filling the unexpired term of somebody. He was filling somebody's term. Now that term's run out. He's agreed to be reappointed. So if someone would like to make a motion to reappoint him.
I'll make a motion to reappoint Mr. Smith to the Planning Commission.
All in favor?
Aye.
And then we have to consider appointments to Social Service Board. Greg Martin has resigned. This term expires on the July 31st of 2026. We've received a resume. We have another person that has shown interest. We don't usually get much interest, so that's a good thing. I think we probably would table this until next month to give time to get any other resumes in that need to be submitted. Any other, any other showing of interest. So, you wanna make a motion to?
I'll make a motion, we table it till October.
Did I hear that? Table to October?
Yeah.
Mr. Mayor, how come we're putting that one into, time for some people to apply, but we didn't give any time for people to apply to the Planning Commission?
He was finishing, he has agreed to serve again. If the person that seat's open now, did they resign? The seat that's open, yes. Greg resigned.
Greg resigned, yeah.
Yeah. So if he had resigned, he'd still be serving.
So once you're on the board, you're just on it? There's no like opening in?
Yeah, there's an ending date, this one was the 31st of July.
And that was put in a paper?
Yeah, that's
for-
it, yeah.
So that was
And
put
then
out in
Smith-
the newspaper for people to apply to that position?
Yeah, Smith, his term expires on the 30th of September.
Right, and you guys ran that in the paper so that people could apply to be on the Planning Commission, like you told them there's gonna be an opening? and-
He finished somebody's term, and now he's agreed to continue to serve, so we don't usually do that. We
So
just-
once you're on a board, as long as you agree to continue on that board, you can continue forever?
No, two terms, I think. Some
So
boards
because
do
this is
two.
only his second term, he's automatically, okay.
He's not even finished, he ain't finished his
Well-
first term of filling in for somebody. So it's, but most boards are 2 terms. I don't think there's any that goes forever. You go on the college board or school board.
But you're putting all things in the paper now and tabling them for a month and collecting resumes, it's not just the DSS board that you're doing that for?
No, we do that, we've done that in the past, and we will continue to do that.
Okay, so that,
So we have an ordinance to consider, it's 2407, amending and reenacting the recommendation of the Planning Commission for the proposed zoning request of Allegheny Highlands Community Service Board of Rockford Drive, 146.6 and 14.146.7, located directly beside 313 Northland Road, which is really. I would entertain a motion to table this till we can get it.
I feel more comfortable with it. Now, Ingrid, is that gonna mess up your side of it? if we wait, get some more information, do it in October? That would be my biggest concern with
We would
Tina.
have to go back to the opioid abatement authority and see if there's a timeline, because I think they've already released those funds to the county.
So what I would like to see happen is to have a public meeting, not necessarily with us here in the chamber, but to have a public meeting to let people come and ask questions that they have concerns about, and see if, through being a good neighbor with everybody, they all work together to see what's the best way to go. That would be
I don't know if there's a timeline on the money, but I can check tomorrow.
I feel better.
Y'all okay with it?
I'd like to see it. I wanna see what's gonna be remodeled and what it's all gonna look like besides a little square on a map.
We have plans that was included in the zoning packet.
Well, I wanna see the facility.
Balzer and Associates gave us, we had, the only thing that hasn't been done is blueprints, and it was all included in the packet.
No, I didn't get these. Doesn't matter.
With that being said, I'll make a motion that we table this until October.
Second?
Second.
All in favor?
Excuse me, Mr. Mayor. Ingrid, do your due diligence over the next couple of days. Please get back with me, and hopefully between now and the 1st of October, when we meet again, that we can convene perhaps up on Monroe with our city council. We'll just have a call afternoon for an hour or two, or evening, and perhaps we'll walk through it of the facility, the property, and at the same time, entertain some public attendance that would be, certainly not to interrupt your daily operations.
So we have to do that after 5?
Yes.
Because we're serving clients.
I
until 5
understand,
o'clock.
just communicate with me, and I'll communicate with our council and our citizens, and we'll do our due diligence. Okay? Look forward to hearing back from you. All right, thank you.
Resolution 2423, school capital improvements. To consider resolution 2422, opioid settlement recovery.
Move for approval.
That's just a little bit of.
It's at 4,000 or something.
Yes. Yes.
Any questions?
4,671.03.
There you go.
It ain't 1.06, is it? Did we get a second?
We did.
Any questions or concerns? Becky, would you do a roll call since it's money involved?
Mr. Carson?
4.
Mr. Forbes?
4.
Mr. Hunter?
4.
Vice Mayor Frazier?
4.
Mayor Sibal?
4. I apologize for being in a hurry. The debate starts at 9 o'clock. Just trying to get on. To consider resolution 2423, schools capital improvements.
Move for approval.
Second.
That's the money
This is
that,
the money returned.
right, and then I requested to put, as last year, we requested the extra funds to go towards the Case Field project. This year, we're asking for the funds to go towards Field D for our girls' fast pitch program in the Allegheny Highlands Public School System.
No second.
You already said. Any questions, concerns? Becky, would you do a roll call, please?
Mr. Carson?
4.
Mr. Forbes?
4.
Mr. Hunter?
4.
Vice Mayor Frazier?
4.
Mayor Sibal?
4. We have a resolution, 2424, reappropriations from the 24 to 25.
Move for approval.
Second.
Are y'all all aware of what you're doing? This is
Carryover.
carryover. BB, is this the one where we're,
This is your annual carryover. You see that usually in September of each year. That's carryover in certain line items. Some line items don't carry over. Grants that have to carry over and projects that are in progress carry over. You take, when you have money from one year left over, you have to appropriate it into the next fiscal year.
so this, all right. So we got Motion and a second. Becky?
Mr. Carson?
Four.
Mr. Forbes?
Four.
Mr. Hunter? Vice Mayor Frazier? Mayor Seibel?
4. Now, resolution 2425, appropriation EQ Basin project payment. Auditor suggests to the council this payment paid in June 24, or auditor will have to account for it as prepayment for the next 30 years.
Move for approval.
And the reason for that, to clarify, that payment is the fiscal year runs from July 1st through June 30th. The bill is due on July the 1st for insurance. So we have to write the check the last week of June. Right? And so being as the check was written and the funds were committed, so it has to be assigned to that year. Otherwise, it shows as prepaid.
So then this doesn't change the payment time.
No, it just, it basically keeps it from showing that way on the books for the next 30 years. It's related to your wastewater payment on the $8 million EQ base.
So checks will be written in June
The check was already written in June.
every year.
Yes. Yes, but we may try to work something out to make life much easier, accounting wise, for the city, for the auditors, and not to have this before you every year. That's correct.
So you think we've done that? We're gonna do that?
We will see what we can do. We don't control that payment date. When it's due.
They don't make it easy.
I know. So we got a motion, second. Any other questions or discussion? Becky?
Mr. Carson?
Four.
Mr. Forbes?
Four.
Mr. Hunter?
Four.
Vice Mayor Frazier? Mayor Seibel?
4. Council, do you have any new business?
Great to see this number of people out. We can get that every month, whether you have something to fuss about or not. We're here. Come see us. Other than that,
Entertain a motion to.
So moved.
Speakers that talk about the same thing. I'm gonna try not to call you any more than about 12 times tomorrow. I'll cut it back to 11 because I'm late. I'm hoping to just survive tonight. Good, how are you? Good, good.
Yeah, thank you, buddy.
I am not going to rush down there. I am not.
We're going up on Monroe Street, how's that?
Just kind of remind us, you know.
I've told Jeff, I don't know all the same, but
Yeah.
this is an
But she can't swear, so she's gonna score over one too. Score over that, then she'll definitely remember.
Yeah, she'll know. They play together. Yeah. Okay, take it.
This part behind that, the first Christian church, part not behind the first Christian church.
What used to be over in Stevie there?
You know, the church over on.
They park
I'm gonna try that.
They're parking there.
Bye, Mark.